Diane Cannon's family and friends for her informative speech. Okay. Hippies, bell-bottoms, peace, love, and the infamous Cheech and Chong are just a few examples of how marijuana is portrayed in our society today. It's a drug that makes you laugh at absolutely nothing, get the munchies, relax completely, and then just crash. That being said, marijuana is America's most used illicit drug. But marijuana is no longer just a habit for aging baby boomers trying to relive the 60s. It's for fragile multiple sclerosis patients and chemotherapy patients who absolutely swear by it. 14 states have already legalized marijuana, and 17 more are now considering it, according to U.S. Weekly Legislative Roundup. And in case you did not know, Pennsylvania is one of those states in which medical marijuana is now being considered. So let's get educated and informed on the facts of marijuana and how it can help patients or maybe someone you love. Let's start with a brief history on marijuana and exactly what it is. Marijuana, also known as cannabis, has many common names like pot, weed, herb, reefer, ganga, and chronic. There are over 200 street names for marijuana. Marijuana comes from the marijuana plant known as the hemp plant. Marijuana is an all-natural substance that has green and a brownish coloring and a mixture of dry, shredded leaves, stems, and seeds. The main ingredient in marijuana is THC, which is a delta-9 tetrahydrocannabinol. It is considered a soft drug, which means it's relatively mild and not likely to cause addiction. Now that we have discussed what marijuana is, let's take a look at how marijuana is effective for medical use. Marijuana is an antispasmodic and a muscle relaxer, a pain reliever and a mood enhancer, and a psychoactive drug. Medical marijuana has been known to help with chronic pain, nerve pain, and muscle spasms, which helps patients with multiple sclerosis, fibromyalgia, and migraines, according to Wikipedia. Marijuana helps with nausea, vomiting, and stimulates hunger, which patients who are going through chemotherapy and for patients with AIDS. Marijuana inhibits mood changes and decreases anger, which helps with PMS and depression. Since marijuana helps you relax and make you feel sleepy, it also helps with insomnia. Now that we have heard all the medical effectiveness of marijuana and about the methods, let's talk about the methods in which it is taken and some of its side effects. Marijuana can be taken in many different ways to suit the patient's needs. You can smoke marijuana by rolling a joint or a blunt. You could also use a bowl, a bong, a pipe, or a vaporizer. If you prefer not to smoke it, you can always just eat it or drink it. It comes in pill form, but it's just less effective. Side effects of marijuana include dry mouth, decreased coordination, unsteadiness, altered body temperature, increased appetite, sleepiness, tiredness, anxiety, paranoia, and distorted perception in time, sound, and sight. These symptoms are short-term. No evidence has shown any long-lasting effects like your everyday ibuprofen, which can cause liver and kidney damage. Now, to help ease your mind about the side effects of marijuana, is that it is very similar to anti-anxiety drugs like Xanax and Klonopin, which are both very addictive and dangerous if they are abused. No one has ever overdosed on marijuana. Now remember, marijuana is just an illicit drug. It's a medical drug being used to help millions of patients around the world for good far more than bad. So keep yourself informed and educate yourself on how medical marijuana could help you or someone you love.